Brought to you by GTA. We start with you.
During our morning radio show containing COVID, Dr. Felix Cabrera of the Governor's Physicians Advisory Council warned island residents not to get too confident about our COVID-19 numbers. Numbers don't lie, but Cabrera said when it comes to positive COVID-19 cases, the numbers aren't painting the full picture.
The harsh reality is that, regardless of what's reported on a daily basis of how many positives there are on Guam, we have to understand the main caveat in these results, or in other words, the main underlying issue that you can't use it to necessarily relate to what the presence of COVID is on Guam, because we've limited the testing and we restricted the testing to priority groups. The number of positives we have is not reflective of what's actually in the community anymore.
Last week, the COVID-19 response team announced priority testing for hospital and ER patients with COVID-19 symptoms, people with chronic diseases and COVID-19 symptoms, healthcare workers and first responders with symptoms, and elderly with symptoms. Cabrera telling KUAM it was necessary to first test these groups since they would be hit hardest by the virus.
And the reality is that the vulnerable group are not the main carriers on the island, and they're not the main spreaders of the disease. It's everyone else, and so that's why our common call is for everybody to assume that you have it and assume that everyone else has it.
And while other jurisdictions have flattened the curve by conducting massive testing for the virus, efforts have been underway to increase Guam's capability to test more people through various avenues like commercial testing and sending samples off island for testing. But Guam only has the ability to run 40 tests a day on island. Testing was limited to the priority groups because there had been, quote, a shortage of the supplies needed to conduct advanced, accurate testing for COVID-19. That's according to a Joint Information Center release. Now, since public health has only been conducting just 20 tests a day for the last few days, Cabrera said results being reported may have the public feeling a false sense of hope when, in fact, our island may be standing on the edge of the COVID-19 cliff.
It gives a skewed view of what's happening on the island right now. Based on our current estimations, that we're probably about 3 weeks behind what we're seeing stateside, in particular like New York. And so we're still in the very, very, very early stages of this.
For Guam's News Network, Chris Barnett reports.
Brought to you by GTA. We start with you.